It's Wednesday. Let's bring in my good friend from Akron Children's Hospital, Dr. Joe Congini. Joe, good morning. Thanks for joining me today.
Hey, Ray. How you doing today?
I'm doing very well. You and your family well, I hope.
We're doing well, thanks.
Hey, what do you have for us today?
Well, we're we're in a little stretch here of really complex issues coming up, and one of them is return to sport play, and from the professional level, college level, high school, and even at the youth level. There's a few things that I wanted to kind of tell you about that I'm involved in as to how people are starting to try to make those decisions. It's a very, very complex question, as many questions are complex right now. I probably have had the last few weeks 3 or 4 of these virtual meetings, these Zoom meetings where people meet from the NCAA. I have one Friday this week from the OHSAA as they try to make decisions going forward. I had one yesterday with a group called Play Like a Champion today that works with young kids around the country. And so it's difficult. And there's a couple of points about this decision making that I would make. Number one, part of the problem that makes this really complex, Ray, first time in my career anything this complex, there's so many layers of decision making when it comes to the COVID situation, the crisis, the pandemic. There's input from the federal government, from the National Institutes of Health. There's input from the state and the Ohio Department of Health in our state in Ohio. There's input from sports governing bodies who are trying to determine what are sports that are more safe that we could start with as we start to kind of allow some opening up and playing sports. So one of the things is there's many layers of this decision-making process. It's not like just concussion where a group of, sports-related people meet and make decisions. This affects a much broader and wider swath of the population. Number two is we're getting results of studies so fast and furious, Ray. It's never really been like this before, but we're hearing studies, and not just from this country. As I looked at a couple studies closely this week from Australia, another one from Great Britain, where we're looking at some of the transmission rates of this virus to see what effect that might have on people wanting to play sports. So the results of studies are playing a role. Thirdly, the results of testing. And finally, we're to the point that a lot of testing is being done. And so we're getting a more rapid look into how many people actually have been exposed to this virus. How many had asymptomatic cases? How many have antibodies? These are all questions that we're starting to get answers to, but we're getting them kind of slowly, and people want to know now, immediately, when can we start playing sports again? And we don't have all the answers yet, but the pace is quickening. One of the things I'd say is our learning curve is accelerating, but people want answers today. So the learning curve is accelerating. One thing we know for sure, there hasn't been much of an event for kids under 18. You and I have talked about that, is there really has not been a lot of pathology at our children's hospitals around Ohio and around the country. There haven't been a lot of significant pathology in 18 and under. But that age range we've been trying to protect so they don't pass it on to adults and especially pass it on to the most vulnerable people. So these decisions are really, really difficult. But let me give you a couple of examples. One of the things, Ray, that's been really fun for me is I've actually been back in the office. I've been able to see some elective patients this year. Wow, you can imagine for me how fun it is to actually get to see a patient and talk to a patient in my office again, an athlete. And so that's been fun. But a couple of examples is there is, for instance, and this was written up in yesterday's St. Louis newspaper, there's a Mother's Day baseball classic baseball tournament. There's 54 teams signed up to play this weekend in St. Louis. And there's a lot of controversy about should these youth teams be playing baseball. They have a lot of rules changes and adaptations of rules to keep it safe, but a lot of people are really questioning, is it too soon? Secondly, I was involved with hearing about a group from, I think it's Seattle, Washington area where they're looking at a Memorial Day soccer tournament. Soccer probably even a little bit riskier as far as contact as baseball is. And so one of my patients in this week was set in a golf tournament starting tomorrow. So there is some youth sports that's starting. Some people are getting started and just kind of going for it and see what's going to happen. Some people are waiting for the results of testing and studies to help guide us. There's many, many layers of decision-making that have a role here. And so this is all a really complex issue. And that's what I'm right in the middle of right now.
I bet you are. And, of course, so many families looking to their soccer fields, baseball fields, golf courses for that outlet for those 18 and under. And right now, all of them in Ohio pretty much dormant right now. Well, golf courses are still going, but the other fields are not. Joe, good stuff
golf
this morning.
Golf is the one, yeah, and golf is really low risk. There was a 5-step risk. This just came out yesterday from the Aspen Institute for Youth Sports, and they had a risk profile 1 through 5, level 1 through level 5. But level 5 was getting all the way to allowing full participation was not until we have a vaccine. So that one would be really slow if we wait all the way for all youth sports till we have a vaccine. And then on the other hand, there's tournaments going on this weekend. So we're seeing the whole gamut of things, Ray, a real wide array. And you know that I'll keep you updated on this as we learn more with big OHSAA meeting on Friday and other things. I'll keep you updated as to what we learn as we try to make these important decisions about return to sport.
Please do, my friend. Always appreciate the time. We'll catch up with you next week.
Okay, Ray, thanks a lot. Have a great week.
You too. Stay well. Dr. Joe Congini, Akron Children's Hospital Sports Medicine Center with us on the Ray Horner Morning Show.